started. We have a standing agenda, so the first thing we're going to do is take attendance. And if this would help KAI, so I've been working with Tony Curtis on KAI, and we're updating our communications plan for this collaborative, and we're updating all the emails and how we send stuff out and all that kind of stuff. So if everyone, when you do introduce yourself, just state your email, or just state who if your email's changed, let us know. Otherwise, just say, remind everyone again what organization you're with, state, whatever, where you are. Okay, so I'm Debbie Dijak. I'm the education coordinator at Archie Hendricks Senior Skilled Nursing Facility, and I'm in Sells, Arizona. And I am here. My email has not changed. Rebecca?
I'm Rebecca Drummond. I'm here with Debbie, and I work with the Conca Board and Foundation on grant writing.
Okay, so grant writing, and she works with our board here at Archie Hendricks. All right, let's keep going.
Hi, this is Lisa Johnson. I'm with Mountain Pacific Quality Health, the QIO in the state of Alaska, and my email has not changed.
Thank you.
This is Shelley Zylstra, and I work for the federal government Administration for Community Living, and my email has not changed.
Thank you.
Hi, this is Melissa Heflin. I work at the Alaska Native Tribal Health Consortium, and my email has not changed.
This is Carly Clausen, and I'm the Director of Nursing at Morningstar Care Center in Fort Washakie, Wyoming. We're owned by the Shoshone tribe, and my email has not changed.
Thank you.
Hi, this is Julie Cahoon with Kaufman and Associates, and my contact information is the same.
Joseph Ray. I'm with a board member at Laguna Rainbow Center, and my email's the same.
Joseph, will Sheila Wiggins be on this call today? Do you know?
I haven't spoken with Sheila, so I'm not sure if she'll be calling in.
Okay.
But Sheila is, for everyone else, Sheila Wiggins is the nursing home administrator at Laguna Rainbow Center.
Yep. That's been a fairly recent change, right? About 6 to 9 months ago?
That's correct.
Okay. All right, good. Anyone else?
Just so you know, this is Tony Curtis, and I'm on the call also.
Okay, and Tony and I have, again, with KAI, been working together on the communications plan for this collaborative. Okay, good. Anyone else?
Debbie? Can you hear me?
Yes? Yes.
Yes.
Oh, Elizabeth, very nice. Okay. Elizabeth Jose is here in Arizona. Elizabeth and I have worked together on the nation for some elder care consortium. That she is our ombudsman. She is currently our ombudsman. So welcome, Elizabeth.
Mm-hmm.
And I'll let you talk a little bit more about what you do here in just a minute, too. Okay.
Mm-hmm. Okay.
Excellent. Thank you for calling in. Anyone else on the call? Okay. All right. So that's our attendance. There may be a few more people calling in. There were a few people new administrators that said they would call in, so we may still get some people calling in, okay? We do have some new members. I wanted to let you know there has been some outreach done since our last call, and I currently, let's see, let me get to my notes here, sorry. I've got on the Rosebud Sioux Tribe, the White River Healthcare Center, White River, South Dakota. I had a call on August 21st with Troy Lunderman. And he said he's working on getting his license as an administrator, but he is currently there in that capacity. And I thought he was going to be calling in today, which would be great if he did. I also had contact with Susan Pourier, Pourier, Oglala Sioux Nursing Home on the Oglala Sioux Tribe in Rushville, Nebraska. She unfortunately could not be on the call. She did let Tony Curtis know that. And the group that Ron Ross, does anyone know Ron Ross? Okay. So I gotta get to my text. Ron is his company is the one that like built the nursing home. And he actually contacted me through Susan Poirier. And I believe he said he was going to come to our annual meeting, which I thought was really great.
I've heard. I was on a conference call with Mr. Ross about a month ago.
Okay. Just remind me, Joseph, I'm not finding his, he's with the Native Health Management, correct?
Yeah, I think it's Native American Management Incorporated.
Native American Management, okay. So I did have some contact with him, and he knew about this collaborative and was interested in being a part of it. So I think, Tony, we did put his email onto the list for today's meeting, correct?
That is correct.
Yeah, so he would have gotten contact. So I just wanted to let you know that we have had some new people, which is really great, reach out to us. So that's great. Calls are being recorded. And I'd like to just quickly, before we do not have a guest speaker today, but we will have our update. And I'm just going to take a look at the minutes from our last call. Lisa, are you taking some notes for me by any chance?
Always. Got your back.
Okay. It's very easy to follow, so I appreciate. So our last call was August 17th. We had Lisa on the call, Tony Curtis, Melissa Heflin, Joseph Ray, Sheila Wiggins, and myself. We kind of went over the feedback from the long-term support service webinars that we hosted in June and July. There was no webinar in August, and I believe the September one is coming up next week on Wednesday, the 27th. I think the invite went out for that. We are still working on the communications plan. Joseph talked about the New Mexico Home and Community-Based Service Agent Conference, which I think hopefully today you'll be able to give us some information on that. We forwarded some information on memory care through activities. We talked about some staffing challenges, and Lisa sent some information that I did forward on recruitment and retention of staff. We looked at our SurveyMonkey responses on the last survey that we did. We talked about being REACH certified and Keep Us Nose training available on YouTube on positive approach to training of dementia. We sent out some information on CMP or civil monetary, civil monetary penalty funds and how you can access those. Tony Curtis gave an update on KAI. We have worked very hard to get our new call numbers. They have, at this point, not yet been approved by John Johns with CMS, which is why we're still using this free conference call number. I'm hoping by October we'll have our new number approved so we can go ahead and start using that. Again, it's always the third Thursday of every month. We set 3 o'clock Eastern time, so it will change slightly if you're not Eastern, depending on where you are. And then our steering committee call will be the second Monday. And again, that's going to be 2 p.m. Eastern time. So we just set the Eastern time as the benchmark for everybody. There was some new YouTube videos on cms.gov, long-term support service. Hopefully y'all had a chance to watch those. I also sent out the information from Western Australian University, where they had done some YouTube videos on dementia. We have a new number here at Archie Hendricks. Hopefully you've seen that on my signature page. It's now 520-585-5500. That is a new number, and it'll need to be changed on our brochure. We affirmed that our annual meeting was going to be October 19th and 20th in Tucson. We'll talk about that today. And the steering committee was scheduled for, oh, never mind. That was taken care of. We did have our steering committee call on September 11th. All righty. Okay, so anyone have any additions or corrections to those minutes from August 17th? All right, so we'll hold on to those.
I have one correction. I'm sorry.
Yep, go ahead.
The conference that I made note of or made reference to was actually called the New Mexico Senior Aging Conference. Aging. Okay. It was not home. It was not home-based title. There was no home-based. To me, I want to clarify that.
That's okay. Was it the Area Agency on Aging? Is that who sponsored it?
I believe so. But it was just called the New Mexico Aging Conference.
Okay. All right. I will definitely make a note of that and get that.
Yeah. I wish it was the home and community-based conference, but no, it wasn't.
All right. Anyone else have any corrections to those minutes? You're not hurting my feelings because it's a lot to remember and put down. Anyone else have any corrections? All right. All right. Thank you, Joseph. So like I mentioned, we don't have a guest speaker. Is there anyone from NICOA on this call? Okay, we have invited Randella. I know that they relocated in New Mexico. They're still in Albuquerque, but I haven't had any recent contact with her staff. We've also welcomed speakers from NCAI and also the National Indian Health Board. So I put that on our standing agenda. I realize maybe right now it's not really actively happening, but I thought, moving forward, it would be a good thing to do. The GWEP, we definitely...
I'll say something, excuse me, Debbie, just for NICOA, just as a note,
okay.
For the rest of the group, and maybe Melissa and Shelley can back me up. NICOA's annual conference will be held next year in August next year, next summer in California at the Pachanga Casino, Pachanga Reservation.
Okay.
I hope.
Right. Is that near San Francisco or where is that?
It's in Southern California, between Riverside and San Diego.
Okay, perfect.
Dates are September 10th through the 13th.
There you go. Thank you.
Uh-huh.
Okay. Thank you.
And that's 2018, correct, Shelley? Yes.
Yes, it is. And the name of the town it's in is Telecum.
How do you spell that?
Telecum, I believe.
Okay. All right. So September 10th through 13th, right?
Correct.
Can you spell the community that it's in?
I don't know the tribal community. Hold on just a second. Let me see if I can find anything on the website.
Temecula.
Oh, it's Temecula.
Ah, Temecula.
Okay, so hold on a minute. Temecula.
Cula.
Excellent. Okay. I was wondering. I think I've heard of that. All right. Okay, very good. Thank you for that information. And we can talk about that too, because we've said that on the off years, we might want to have our annual meeting as part of that. And it would be nice if we announced that now so people could plan, but we can talk about that here in just a minute. Feel free to interrupt me at any time, okay? I was listening to National Public Radio this morning on the way in, and they were saying how collaboratives are like a tennis match. You're supposed to be hitting the ball back and forth. So I'm hoping to hear a lot of bouncing back and forth today. The GWEPs, the University of Arizona, just as an aside, they are hosting our annual dinner again on Thursday night, October 19th. So I have been working with Lisa O'Neill at the University of Arizona Department of Aging. So we don't have really any other GWEPs really on board with our collaborative right now, but that is something obviously that we want to keep on the agenda. The QIOs,
Melissa represents the GWEP, right?
For the Alaska,
Yeah, you and Jordan are part of the GWEP. I hope.
yeah, so I was, I think they had their meeting last week while we were in Minneapolis. I'm not sure what has occurred since the meeting 3 months ago. I can send an email and find out and then email the group.
yeah, Melissa, if you can send me like the name of, give me something kind of official so we can kind of add that onto the minute. I guess I kind of knew that, but I kind of missed, that it was actually funded as a geriatric workforce enhancement program. So we probably need to get that in here. It's through the University of Alaska in Anchorage, correct?
Yeah, so it's a partnership between the UAA and also South Central Foundation, their NUCA model. And they're having their last cohort of attendees this fall.
When does that grant end?
I believe it's scheduled to end April of 2018, but I'm not 100% sure on that.
Okay, because I know that the HRSA, so that the GWEP grant also funds part of what I do, and I believe it's June for the University of Arizona. Like after June 30th, if it's not refunded, then that'll be the end of it. I think it ends June 30th. Yeah, 2018.
Yeah,
yeah.
I think they're in their final year of funding
right.
This one up here.
Yeah, so send me anything you can on that for the minute so I have it officially in here. We might want to advocate a little bit for those GWEPs too, because we certainly have benefited from their existence. Lisa, do you want to give an update on the QIO from your perspective?
Yeah, I guess right now most of us are just kind of busy trying to support our nursing homes with the new mega rule conditions of participation, Impact Act, and all the changes that are hitting this group. So we've got meetings and trainings and things like that going on around the state and around the nation to help with that. But it's a little bit like trying to drink from a fire hose.
Say that again.
Like trying to drink from a fire hose.
In other words, lots of stuff to take in all at the same time.
Yep.
I feel like that too. There's
practices.
What?
Pardon?
This is Tony Curtis with Kaufman and Associates, and I'm new to this topic a little bit. Can you go a little bit more in depth, and would it be a benefit to maybe develop a best practices document that would benefit all tribal communities? Is it kind of on that topic?
That's a good idea.
So the new rules of participation that affect nursing homes are being phased in 3 different phases. And phase 1 went into effect last year. Phase 2 hits our group on November 28th of this year. And then there's phase 3 regs down the pike a ways. So AHCA, the American Healthcare Association, my understanding is they're the sort of big umbrella over each state hospital and nursing home association. AHCA has done a really great job synthesizing the new rules and coming out with checklists and stuff like that. So I'm not sure that we'd be able to create a best practice that's better than what's already out there. But I do think making sure that the tribal nursing homes know about this, the tools that ACA's produced, they're better than anything I've seen from CMS or from any other QIO. So I use those resources almost exclusively for the work that I'm doing and sharing with my nursing homes. But it's, the new rules are a big deal for the nursing homes, and I think a lot of them are struggling trying to figure out what they need to do and how to meet some of the new regulations. And along the lines, we might be able to support the tribal nursing homes around specific areas. For example, trauma-informed care is a new regulation. I think that might look different for tribal nursing homes, and that might be an area where we could jump in with some best practice as an example. And that's just my thought as one of the groups. So I'm not sure what other folks would have to add.
That's really good, Lisa. Anybody else have any thoughts on this idea of supporting tribal nursing homes and some of these new mega rule changes? The only thing I thought about, Lisa, when you were talking is the knowledge part of it, of resources and tools, and also prioritizing, because that can be really overwhelming when you're hit with so many things at one time. Like, what do we prioritize? What comes first, second, third if you're taking this on? Anyone else have any thoughts on that?
So that's along what I was kind of thinking, Debbie, is could this be turned into not necessarily like a best practices, but kind of, it has the name best practices, but really it's a recommendation from this collaborative to try and aid other nursing homes. So could we compile a tool like that and basically consider it a best practices and a guide?
Mm-hmm. Anyone have any thoughts on it? I think that's a great idea. It wouldn't necessarily be a change in our topic for the year. It's just to say that this came up and maybe we can work on this. I'd like to suggest that we maybe have a little subcommittee. What do you guys think about that? They could just spend a little bit of time putting this together.
I would like to see it developed. I'm sorry, I apologize, Tony, but I was just going to say I'd like to see it developed as some type of best practice tool for use of new board members that have never really been, exposed to the regulations. They don't really know what's in store as the board member of a nursing facility. So that's where I'd like to go with that. That's all I want to say. Thank you.
Excellent recommendation. Yeah, and that's real consistent with what we're doing.
Yeah, I was just going to say, I think that aligns nicely with that sort of theme that we've identified as how we can support boards that have the oversight responsibility for our tribal nursing homes. And of course, I love the idea of doing a subcommittee and working on that. I'm just always concerned as who is going to do the work, because we are kind of constantly challenged with getting people to be active and participate. And I know right now I just can't take that project on. I'd be certainly willing to support however I can, but I would love to see some other folks step up and lead some of this work, because Debbie, I know you've done an awful lot, but we need to get some other people involved. And also, if it's to meet the needs of the nursing homes, we need the nursing homes to participate and tell us what they need.
Right, exactly. Okay, so I'm just going to suggest, for time's sake, that I send out an email explaining this and just to all members and say, maybe we'd like to have, what do you think, like maybe 3 nursing home, maybe a couple of board members, 2 or 3 administrators, and maybe 2 or 3 directors of nursing. And maybe, what do you guys think about something like that? And I'll be a kind of a resource backup too. What do you guys think?
I think that sounds good, and of course, I'm happy to provide resources as well. I just don't want to get too much in the weeds.
Okay. So let's see what we get. We'll recommend 2 to 3 administrators, 2 to 3 DOMs, and maybe a couple of board members. Okay. All right. Sounds good. Let's give it a try, see what we get. All right. Thank you, Lisa, for your report. Appreciate that. We're going to go on to the ombudsman. So, Elizabeth, can you just briefly introduce yourself and just kind of let us know what's happening in the world of ombudsman?
I'm fairly new. Can you hear me?
Yeah, just speak up.
Okay. I'm fairly new. I just started for the Nation Ombudsman. I work for Senior Services. And we just go into the nursing homes and do visits. And if we have a complaint, we just go in and talk to the resident. And we do presentations for the resident councils or a group. I'm planning on doing one for Archie Hendricks ALF Assistant Living, a presentation next month. Just to let everybody know that we're here. We're here at the Nation. If anybody needs our services, we just mainly talk to the clients and then just see what's going on, and try to work with the nursing homes to kind of figure out what we can do to help the residents feel more comfortable or whatever their complaint is. So
well, welcome to the group, Elizabeth, and we have a great ombudsman here in Alaska named Teresa Holt, who's been active with the U.N.I.T.E group as well. And I know when folks are new on jobs, I always feel for that learning curve, and so just wanted to reach out to you and let you know if there's anything that we can do in Alaska. Please give us a call.
Okay.
And Elizabeth, Lisa Johnson has been great giving us just all sorts of great resources and connecting people, so it's always helpful. So thank you, and welcome, Elizabeth, and thank you for being on the call. Truly, it's really appreciated. KAI, Julie, just one of your folks want to give a quick update on what's happening with what we're doing here with communications?
Okay, so Julie's kind of handed it over to me a little bit.
Okay,
and
that's
so
fine.
We have the U.N.I.T.E group that will be presenting for the LTSS webinars in May and July. Just to give a heads up on when those are presenting. I did want to bring attention to our next webinar that is coming up on September 27th, and it's Building LTSS through Title VI Programs, Billing and Medicare. And so we have a wonderful presenter that's going to give a lot of information on how to use the finding and working with the challenges of funding, and giving really positive information on how to fund sources for home and community-based services, including caregiver support, nutrition services, and transportation. And then billing Medicaid for these services. And it'll allow tribes to stretch their dollars just a little bit further. So that's the upcoming topic on September 27th, and I think it'll be really beneficial. We also did a little bit of outreach and promotion for the upcoming conference on dementia and Native Americans in our newsletter, the 13th annual conference of Alzheimer's and disease and dementia in Arizona, which is kind of working in conjunction with Debbie and the annual conference or the annual meeting. And then also there was a really nice highlight of emergency planning. So this is some really good resources and things to think about, which is emergency planning for home care facilities. With all of the things happening in our nation right now, it's just bringing really good focus on having a plan, having a couple of days of medication and supplies needed, and just kind of working with either FEMA or CDC or your own plan or some of the things that are available on the LTSS outreach and support website. And just being ready for natural disasters and having a plan and having kind of some things worked in. Debbie gave some really positive feedback on that. And then also we had a couple other from the Laguna Rainbow Nursing Home Center.
Sheila Wiggins, I think, gave you some insight. And also Agnes Sweetster from Alaska, correct?
Correct. So there was some really good stuff in regards to just basically having a emergency plan and preparedness for tribal nursing homes and LTSS programs. And
so I just want to.
Oh, go ahead.
Oh, okay. Let me just interrupt for just a second here. I just want to say something. We were contacted by KAI after our last meeting, to do like kind of an interview with them. Now, I did that interview several weeks ago based on some information I just took from our staff, but it would have been helpful to have a little more feedback. I mean, it was okay, but I think as a collaborative, when we're asked to maybe get a little information, it's, you know, maybe just talk to your staff, even if it's just 10 or 12 people, get some feedback and then forward it. You know, it would have filled out that interview a little bit more. I took what I had with my staff because we're meeting on a regular basis for our disaster committee. And we also, like you said, got information from Sheila Wiggins and also from Agnes Sweetser up at one of our Alaska assisted living homes. And she gave some really excellent information. If you're not aware, there was a Senate hearing yesterday on Wednesday about this very issue. And there's actually a subgroup on the Gerontological Society of America that I'm part of that they're also putting out a lot of good information on this topic of vulnerable elders. So thank you to KAI for really bringing this up and even, you know, asking for our feedback. I really appreciate that.
Most definitely, Debbie. And then finally, our last one is Debbie and I are going to be working on updating the tribal nursing home directory list. And so we're going to do a little bit more review of that. Debbie has some recommendations. And if you do also some things that you'd like to see on it, kick those over to Debbie and myself, and we'll go ahead and try and just work on growing that directory a little bit better and more accurate so that it's available for all.
Okay, good. And I want to thank Tony, too, because the invite that you got for today's meeting, even though this won't be our official number, he put that together really well. So now there's a link to the agenda, and there's also a link to there's going to be a link to our Weebly.com website, and also a link to CMS.gov, so people can go right to where we're housed on the CMS.gov website. So I don't know if y'all noticed that, but I thought that was really well done.
And that's another good one. Thank you, Debbie. Also, was there any feedback that you guys would like to see something in there that wasn't, or which would be beneficial for you in notifications?
This is Joseph. Will we be able to have a link for our minutes? I was having difficulty opening our Google Docs today.
Yeah, that's why we're involving KAI, so we don't have that problem. Tony, let's do that. Let's make that available. So when we send out the invite for October, the September minutes should be on that. Let's do that.
Agree with Joseph that I appreciated that new format with the link for the agenda and so forth. Not having Google Docs, for some of us, it is just a nightmare trying to get to Google Docs. So I appreciate having it in that other format.
Okay. Yeah, let's do that, Tony.
Okay, thank you.
Okay. That's fine. There's no problem to that. We can do that. And then if you see any issues, try to let me know ahead of time if you see anything that's not right on there. I wanted to mention, too, on the disaster preparedness, we have the Arizona Healthcare Association, a representative, come out here to our nursing home. And Joel was actually one of the first responders for 9/11. So he's got a real extensive history of dealing with disasters, very, very helpful gentleman. And he referred us to FEMA.gov. There's 2 courses on there. One of them is ICS, their Incident Command System 101, and ICS 102. And he highly recommended that all our staff watch those. So they're kind of thinking about how you would respond in an emergency. So I'll just pass along that suggestion to all of you.
I'll just add, going back and on the emergency response around our nursing homes, Miss Wiggins, Sheila Wiggins from the Laguna Rainbow Center, and I had a short discussion about why we need to keep tribal entities aware that they need to include our nursing home in any plans for emergency preparedness, disaster planning, anything like that. And I just reminded Sheila that the council is that's what they're tasked with, protection of all people. So keeping our tribal council in the loop about these topics, I believe, is a positive thing. Thank you.
Yeah, I agree. Thank you, Joseph. And we actually reached out to our Office of Emergency Management here, and they actually came out and met with us this past Monday, just a couple days ago, and it was a wonderful meeting, really, really helpful. So thank you. That's very true. Would anyone else like to comment on that topic of disaster preparedness?
Debbie, this is Lisa, and I'm so focused on Alaska, sometimes I forget about the U.N.I.T.E group in addition, but I just sent an email to my nursing homes yesterday with a lot of really great resources around water and water resources. There was questions about how much water and a lot of very detailed questions about some of those regs. So I will forward that email to you and ask you to share that with the group. I have gotten a lot of good feedback, and I think there's some great resources that might be helpful to the tribal nursing homes.
Excellent. Thank you so much. Anyone that has resources like that, please forward them, okay? Everyone, we can all benefit from that. Thank you, Lisa. Okay, good. Tony, is there anything else?
No, that's all for right now.
All right, thank you so much. Any administrators on the call right now? Any administrators on the call right now? Going once? Going twice? All right, any directors of...
Debbie, I saw
any directors of nursing?
From Gerald up in Bethel saying that he was having difficulty. He had an old call-in number. So I just sent him an email. I just noticed his email, so I just sent him an email, but it does look like Gerald was trying to call in. So
okay, I'll send him a quick.
Yeah, it's just, I didn't see that he was on that invite from Tony Curtis. And I didn't look through it terribly completely, so I might have just missed it. But I might want to, as we're looking over those contact lists, just make sure we've got everybody on the new invite.
Okay, Tony, Tony, remind me. We'll talk about that afterwards. Okay, I'll send them an email right now. DON's on the call, directors of nursing, that we could get a report from you, please.
This is Carly.
Yeah.
We've just been working here on phase 2 of the new CMS regulations, so we're fully into that. We just completed our new sensory room. We have like 8 different kinds of lighting in there, string lighting, all sorts of stuff to make it relaxing for dementia or Alzheimer's patients. We have some like stationary rocking chairs, a fountain, all sorts of stuff in there. We have a flat screen TV that we use to stream YouTube videos in there for whatever the person likes. We have one person that gets really confused, but they like to watch videos with baby animals. So depending on the person that's in there, we can play, something that they like.
Wow.
Yeah, it's super cool. So we've been working on that for a while. We just got that done. Other than that, we're doing some remodeling here, so that's very time consuming for all the staff. So CMS regulations and remodeling, that's been the brunt of our month. So
very good. Excellent. We're very pleased that you're getting that sensory room done. Would it be possible to take a few pictures and send them to me, and I'll share them with the group so they can see?
Sure, yeah.
Okay. All right, sounds good. Anyone have any questions?
Sorry.
No, go ahead. You're on.
Thank you. Carly, can you remind me what phase 2 of the CMS regs is based on again?
There's a huge list. The phase 2 is due in November. I can probably forward you some information on that, but I can't give you everything off the top of my head.
So it's a whole set of regulations that the feds are tightening up, CMS is tightening up, and that we as centers have to adhere to by November 1?
November 28th, correct.
November 28th.
Yeah, and they really do kind of cut across all different standards, everything from infection control to leadership to dietary, nutrition, dental services. It's pretty comprehensive. Some of them are just little, quote, little tweaks, policy changes, things like that. Others are brand new and require some thoughtful process evaluation. Again, I'm happy to share a summary information that I've gotten from AHCA, the American Healthcare Hospital Association, and it's probably as summarized as you'll find it, but it's a big chunk of stuff. Just heads up.
I also have some documents from Leading Age, Joseph, that are pretty readable, and I'd be happy to send you those. So I think we need to send out some phase 2 stuff is what I'm hearing.
I agree.
Well, and that's, Lisa, that's only though if you're accepting Medicare or Medicaid, right? It comes under that.
If you're licensed by the state, is my understanding. If you're taking Medicare, Medicaid funds, yep.
Yeah, then it applies to you. Okay. So I know I don't want to run out of time. We still have some things to do. Are there any board members on the call or tribal assisted living facility leaders? Anyone in that category? All right, I'm going to let Rebecca Drummond give us a grant update. I want you to remember that Rebecca will be at our annual meeting on Friday, October 20th, and she will be leading a discussion so that we can get together as a collaborative and apply for some grant money for 2018. So, Rebecca, I hope you get everything.
Hi.
I'm going to let Rebecca sit closer to the phone here.
Well, we talked about it before. Specifically, there is a grant that U.N.I.T.E applied for through Tonka, and it was not awarded. It was a 1-year planning grant for about $100,000. And these grants are to develop a network. Sometimes they're hospital network. There are 3 grantees currently in Arizona that I am familiar with. There's a basic requirement to have 3 entities sign an MOU to be the network. And in some cases, you might grow or expand your network. So apparently, they will be offering, we think, announcing the same grant again this year. They used to do it every couple of years, but now they're doing them annually for the planning grant. So we're anticipating an announcement in the fall. Last time the due date was right after New Year's, and so it was like January 3rd or something like that. So we have some time to be a little more organized. I think we put it together in about 2 weeks last time. The State Office of Rural Health here in Arizona is the designated technical assistance provider for this grant mechanism, and they currently have our first application, and they're going to review it and provide us some advice and feedback. So hopefully by the time we have our annual meeting here in Tucson, I will have that summarized, plus the reviewer comments from HRSA. But it'll give us a little more time to actually strategically think about what you want from this network grant. The main benefit of the planning grant is it puts you in a position. I think the main outcome is to have a strategic plan for your network or your collaborative. And then you're in a good position to apply for what they call network development grants. And those are 3-year grants with, I don't know, close to $1 million budget. So the idea is that we would actually have an opportunity to apply for the next level of funding. So I think that's my update. And we'll talk more at the annual meeting.
Thank you, Rebecca, very much. Does anyone have any questions? This is kind of a big deal, and Rebecca is not charging us for her time at this point. So Anyone have any questions?
No questions, but thank you, Rebecca. That's really wonderful. We appreciate that gift.
Yeah, we really do. So I'm going to let Shelley. Are you still on the call?
Sure am.
So if we could get from anyone who went to Title VI, if we could get a little report on that, and then we need to talk about our annual meeting. So we don't have a whole lot of time, but I apologize. But go ahead and give us a quick recap.
Well, I may have a different perspective because I did a lot of training there, but I felt like it was well attended, and I was especially excited to see what seemed to be more people from Alaska. So I appreciated that. The listening session was really not much new except the same old, same old. But one of the things that was really critical was that Cynthia announced that people had inadvertently left pieces out of their application, and about 10% of the money allocated to the Title VI programs actually went back to the federal government. It was not spent. And so there was a movement to say, hey guys, let's try to get this working. Let's try to pay attention to our finance as well as our program and make sure we're tracking that. So those of you who work in a community where there is a Title VI program, you may want to talk with them about potentially taking them under your wing or helping them. If you have a program that's, well, I'm not going to say basic, but maybe the director is also the cook and the transporter and the everything else. I think it's important for them to have someone mentor them in terms of good business practices, and that may be one thing to do. I discovered in some of my breakout sessions that we have tribes all over the country who are purchasing food under separate contracts. So each tribe has 5 different food contracts. And of course, when you're all purchasing under different contracts from different vendors, your prices are going to be higher. And so I encouraged tribes to go home and talk to their Head Start programs, their schools, their casinos, their skilled nursing facilities, their hospitals, and get everybody purchasing underneath the same contract because they'll get better prices. So that was kind of a take-home message for me. There were some excellent speakers. Some of the plenary sessions were really, really good, and I enjoyed those immensely. There was a good breakout on a good plenary on elder abuse, and I enjoyed that. I don't know. Joseph, Melissa, you want to add anything?
This is Melissa. So I was also pleased to see a lot of Alaska representation. I think there was maybe, and this is an estimate, it's about 14 individuals. And the breakout sessions were very beneficial. And it was good, it was kind of different this year, it seemed to me, just as an attendee perspective. A lot of focus, so our work group has been promoting a lot of traditional foods within our nursing homes. So for this conference, there was a lot more emphasis, just from my perspective, on the importance of traditional foods for our tribal communities. And the only recommendation that I put on one of the recommendations was, since we did have such a high number of Alaska attendees, is to have a presentation, and maybe Shelley, you can help advocate for this, but have half of a presentation be an Alaska perspective on transportation barriers to serving, the Title VI recipients, and then a reservation perspective on, the same. So that way, all of our tribal communities can understand the significant difference that we face as tribal people. So
yeah,
that's all I have.
I can very much advocate for that, Melissa, and I appreciate the suggestion, because I think many of our tribes think that they're rural, but they don't even know rural when it comes to comparing what Alaska is dealing with.
Very good. Thank you. Joseph, did you want to comment?
Let's see. I agree about the traditional foods emphasis at the conference. I thought that was great. I ended up with someone giving me some fresh king salmon, so I was very pleased.
Score!
Yes, and so
that was Manny. That was Manny from Danakanaga.
Right, that was awesome. It's still stinking up my luggage.
There you go.
So I have my luggage airing out, and no, it was a good conference. I was asked to be a presenter about some basic information about having to use my wheelchair on the reservation, and I think it's universal. Our tribal nations aren't paved and cemented over. Some of the areas that are more developed, yes, but and that's one thing about the place we were at, Shakopee, Mystic Lake. There was a lot of cement and concrete, and I had a lot of freedom. I could wheel my chair with ease, but again, that's not my reality back here at home. It's back to the dirt and rocks here at home. So again, that was my presentation about just basic realities about using wheelchair on the res. And but no, it was a very enlightening conference. Again, I always am able to bring home information for my tribe and for my people regarding how easy we have it compared to Alaska. Again, about transportation. I know we're spoiled down here, but that's just how we are. So, no, we just need to be reminded all the time about the again, how difficult accessing services for our elders in Alaska is, and I again, it's we need to keep advocating for our elders even if we're not in Alaska.
Well, I think each tribe has its own unique challenges, and I'm curious. I heard both of you mention that there's a lot of emphasis on the traditional foods aspect at the conference. Do you feel that's from the work of U.N.I.T.E that we've been able to sort of carry that flag forward and it's waving strongly? Because that would be exciting to hear.
Oh, sure. We'll take all the credit we can, even if it's not really there. But you know what? Just real quick, my perspective is that I think there's pockets of us all working around the country to promote traditional foods for our elders, because we know that that enhances their quality of life if they have access to traditional food. So that's just my perspective, and again, I would like to give U.N.I.T.E all the credit, but I can't say that we've reached all the leaders yet, and but we have to keep working.
I think the vast amount of credit for that particular movement lies squarely in Alaska. Previous to the changes to the Farm Bill, it just wasn't allowed, and it wasn't allowed anywhere. And so there was a group that brought actually to a Title VI conference, and Melissa, I can't remember when the change took place, but it was the conference that we had right before that Farm Bill got passed. And they brought their Alaska congressional delegation to that meeting. And I remember being surprised to find them in the back of the room. I was giving a presentation about traditional foods at that point in time. They went back and looked around and tried to figure out, and they were the ones that actually added it to the Farm Bill, which gave us the permission to actually move forward. But I think, Kay Branch and I have been talking about this issue since '89. So it's something that has been long-standing, but no joint effort. And I think what U.N.I.T.E has done in particular is bringing it to the skilled nursing facilities, which are so highly regulated. And I love the fact that you guys are being able to do that in the skilled nursing facility and educating surveyors and other individuals about how it's the right thing to do. So U.N.I.T.E certainly had a big hand in it.
Well, I appreciate that. You know, I'm gonna interrupt here because it's after 1 o'clock or almost 1 o'clock, and we need to just quickly talk about our annual meeting. So, and I don't want to go over too much, or people will need to be off the call. So I'm going to interrupt here for a minute and just say that our annual meeting is a go. Okay, so we've got about 9 people confirmed. Now, I'm going to send out a list of those people because I want to make absolutely sure that the people who told me verbally they're confirmed are confirmed. But we're looking at arriving. You can arrive on Wednesday. Thursday will be the whole day of the Alzheimer's conference at the Casino del Sol in Tucson, Arizona. Tonka, our board has approved a driver provider, a van like we did 2 years ago, to take us from the casino to the nursing home. So I have it departing Friday morning from the casino at 07:30 and leaving here at 4:15 to get you back to the casino by 6 p.m. And you could either fly out Friday night or Saturday morning. I want to say that the dinner we have it all worked out with the casino. The University of Arizona GWEP is paying for that again. It's going to be a buffet dinner poolside starting at 6 p.m. that Thursday evening. And the minimum is 20, that we had to do at least 20. So I'm hoping we'll get to that. So if you have not committed to coming yet, I'd really encourage you to do this. We are going to have such an awesome time out here Friday morning. The board is paying for our breakfast and lunch. We are celebrating St. Francis Day. We have a lot of cultural activities and traditional food going on Friday. And everything's set up. It's going to be great. You just need to get out here. The cost of the conference is only $25. If you want to come on Wednesday and get the toolkit, that's only $25. And I think the rooms are like $129, so it's extremely reasonable. Okay? The only question I have for all of you is whether you would like me to arrange a very short, kind of fun speaker for Thursday night. He's more of a get-to-know-you kind of entertainer, and he's a tribal member. Would anyone be interested in that for Thursday night as part of our dinner?
I'm not going to be there, so I don't feel like I should answer.
Okay. Anybody have any thoughts on that? Do you want someone there, or do you just want to do the dinner and visiting on Thursday night?
We probably need an icebreaker.
Okay.
But just
okay.
But we don't. I mean, I'm more than happy to tell jokes, but I think.
Oh, that's good. You shouldn't have said that. I've got that in a minute.
Mm-hmm.
Okay, you're on, Joseph. That's good. All
No,
right. Anything else?
Just having someone that can just open the night for us for a few minutes, I think will be good.
Okay. All right. I'll see what I can work out. He's done it before for me and not charged anything, so I'll see what I can work out. See if I can offer him a dinner. Okay. Thank you, Joseph. Okay. Anybody else? I'm sorry to interrupt, but I just really want to make sure we're staying on board with our meeting call time. Anyone else have any new business? Anything else to discuss?
Debbie, this is
Melissa. Go ahead.
Yeah.
The only thing that I have is, any updates to the brochure other than the phone number for the Arizona facility. So we are approaching the end of our fiscal year, and I can get those printed by the end of next week and then sent out to you.
Okay.
But I just need to know, are there any other changes to the brochure before I, send them to our print shop?
Melissa, do me a favor. Send me the brochure again, and send it if you can as a Microsoft document, not a And I'm going to save it that way and send it out to everybody today. If everyone could just take a look at it, if you see anything on that brochure that needs changing, please, we've got to do this and get in so Melissa can print out more for us, okay? Because we've had some changes. I love the color, by the way, Melissa. I would not change the color. I think it's beautiful.
Debbie, this is Lisa. I know that it may be time in terms of a timeline, it won't really work out well, but just in the future, that might, looking at that brochure and visiting sort of the key points that we've got on there, might be something good to do at the annual meeting in the future.
Okay, that's fine.
When everybody's together, you know.
Right. We did ask for feedback quite a while ago, too. We just didn't get a whole lot, so, okay. Anyone else? Joseph, you had something?
I was just going to ask if Rebecca or Debbie could give me a quick call back after the conference call. I have some ideas about our funding for our U.N.I.T.E group, and especially for any proposals we might be submitting. So, do you think you might have time to call me back after this call?
Absolutely. Rebecca's sitting right here. In fact, if you just want to stay on when everyone hangs up, we can talk together.
Okay. I'll stay on.
Okay.
Thank you.
Okay. Anyone else with new business or any comments, any announcements, anything?
Nothing for me.
Okay.
Nothing here.
Okay. I would like to thank you all for being on the call. It's really important. And Shelley, thank you for being on the call. I know you're extremely busy, and we appreciate it a lot.
Oh, hey, no problem. It's always good to hear from you guys and hear what you're up to. I'm always so pleased to hear about progress. So thank you for including me.
Yeah, and say hi to Cynthia for us. And
I will.
And Elizabeth Jose, thank you as ombudsman. We appreciate it, too.
Mm-hmm.
All right. Bye, everybody.
Bye-bye.
Okay, bye-bye. Bye-bye.